Good morning. I'm Travis County Judge Andy Brown. I want to thank you all for being here. It's a hopeful moment for Travis County today, and this is a moment that all of us have worked very hard to reach. For the first time in years, we're seeing a significant and measurable decline in drug-related deaths across our community. According to the soon-to-be-released 2024 Annual Medical Examiner's Report, drug-induced accidental deaths dropped by 22% in the past year, from 486 deaths in 2023 to 380 deaths in 2024. 1 year ago today, we stood before you all to acknowledge the highest rate of accidental overdoses ever recorded in Travis County history. Today, deaths involving fentanyl, accidental overdoses, one of the deadliest drivers of the overdose crisis, have decreased by 36% from 279 in 2023 to 179 in 2024 for fentanyl deaths. The decrease in drug-related and fentanyl deaths is a direct result of the work that so many of y'all and others across Travis County have been doing. Over the last 4 years, Travis County has allocated almost $5 million in federal and local funds and grants to address the opioid, fentanyl, and overdose public health crisis head-on. And earlier this month, the county received another $1.4 million in new opioid abatement funding from the settlement to continue on our progress. From public health officials and emergency responders to harm reduction advocates and local organizations, this has truly been a community-wide effort. Whether it's distributing Narcan, expanding access to treatment, building trust on the ground, or pushing for policy change, we're making a difference together. And while we still have a long way to go, this drop in overdose deaths shows us that the strategies we've implemented are not only working, but they're saving lives. You'll hear more shortly from our partners about the specific data and strategies and programs that contributed to this progress, including how collaboration at every level of government and community has played a key role. But first, let me just say to the community, thank you. Thank you to the community leaders, healthcare workers, first responders, Health and Human Services staff, advocates, and our city partners who show up every day to meet people where they are and to help them stay alive. This is what happens when we lead with compassion, science, and partnership. And to the families of loved ones who lost to drug and fentanyl-related overdoses last year, I speak for Travis County and everyone in this room that your loved one's loss will not be in vain. Their memory fuels our commitment to prevention, recovery, and justice, and we will not rest until we've built a safer community for everyone. Now I'd like to welcome Dr. Keith Pinkard, the Chief Medical Examiner for Travis County, to share more details on the data behind these encouraging numbers. Dr. Pinkard.
Thank you, Judge Brown. Good morning. Thank you all for being here. My name is Dr. Keith Pinkard. I'm the Chief Medical Examiner for Travis County, and we have completed the annual report for calendar year 2024 for the Medical Examiner's Office. And today, I would like to summarize the data on accidental drug deaths in calendar year 2024. Drug toxicity remains the most common accidental cause of death in Travis County. It has been number one since 2021. There were 380 drug toxicity deaths last year in 2024. That being said, there were 486 such cases in 2023, representing a 22% decrease in overall drug toxicity deaths. So this is very good news and very encouraging news. As we've seen in several years previous, the majority of drug deaths are due to a combination of drugs rather than a single drug alone. 58% of all drug deaths are due to the presence of more than one drug being present in the body. Looking more specifically at fentanyl, we saw a 10-fold increase, so 1,000% or more, in fentanyl deaths from 2019 at 22 deaths to 2022 with 245 deaths, with another increase in 2023 to its highest number yet. In 2024, however, there were 179 accidental drug deaths involving fentanyl. This is 100 fewer than the prior year in 2023, representing a 36% decrease in deaths involving fentanyl. So this is a substantial decline that we're seeing. And so the number we're looking at is now intermediate to the numbers of fentanyl deaths we saw between 2021 and 2022. One of the other statistics that we have been tracking over the years is the percentage of all drug deaths that fentanyl-related deaths account for. So back in 2019, 12% of all drug deaths involved fentanyl. This rose to a maximum in 2022 at 59% and a similar percent at 56% in 2023. In contrast, in 2024, the percentage of all drug deaths with fentanyl involved declined to 47%. So what this means is that not only is the absolute number of fentanyl-involved drug deaths decreasing, but the percentage of all drug deaths involving fentanyl is also decreasing as well. Similar also to previous years, it is quite uncommon for fentanyl to be the sole drug involved in a drug death. Only 11% of drug deaths involved fentanyl alone, meaning that the remaining 89% of drug deaths involving fentanyl involved one or more other drugs as well. So to summarize, there was a 22% decrease in all accidental drug deaths, a 36% decrease in fentanyl-involved drug deaths. And I think this is very good news and speaks to the efficacy of the interventions such as naloxone distribution and other harm reduction measures that have taken place over the past few years. So this concludes my summary of the drug death data from 2024. The entire annual report will be published to our website soon, and we'll also be presenting this data in Commissioner's Court. I will now pass the podium to Dr. Desmar Walkes, the Austin-Travis County Health Authority. Thank you.
Thank you, Dr. Pinkard. Good morning, everyone. I am Dr. Desmar Walkes, Austin-Travis County's Health Authority and the Medical Director for Austin Public Health. As many of you know, opioid overdoses affect every part of our community. No zip code has been untouched by the devastating loss of life due to accidental drug poisonings. This widespread crisis demanded a united response. That is why Travis County, the City of Austin, and our partners, including the Texas Harm Reduction Alliance, came together early with a shared goal to educate, equip, and empower our community to act. So far, we have distributed more than 36,000 doses of life-saving naloxone to our community partners, city staff, county staff, and members of the public. We have also trained more than 1,000 individuals, including city and county employees, on how to recognize and respond to an overdose. Messaging to the community has also been crucial in these efforts. We launched the In Austin, We Keep Each Other Safe campaign with the UT Center for Health Communications, which delivered over 40 million impressions last year. These efforts are saving lives, and we are committed to continuing this work. Today, while we acknowledge promising progress, I want to emphasize that the work is far from over. Every person we can train in overdose response and equipped with naloxone can save lives. For those listening today, here are some steps to prevent an overdose. Never use drugs alone or behind a locked door. Let others know if you have naloxone, especially those around you. Learn the signs of an overdose: pinpoint pupils, reduced alertness, and slow or absent breathing. If someone shows signs of overdose, even if you're unsure, administer naloxone, start basic life support, and call 911. Remember, opioids can last longer than naloxone, so continued care is crucial and critical. Thank you. Thank you. And now I will turn it over to Austin-Travis County EMS's Chief, Robert Lucas.
Good morning. Robert Lukritz, Chief of Austin-Travis County EMS. First, I want to start off and thank the judge and the commissioners and everyone here today for their overwhelming support in this mission to try to reduce unnecessary overdose deaths. Their commitment to public health and harm reduction has made a real, measurable impact. As mentioned, we've noticed a significant decline in overdose deaths here in Travis County, and this is not a coincidence. It's the result of intentional, community-based efforts and strong partnerships amongst those here in this room and beyond. Every life saved represents a moment where the right resource met the right person at the right time, which is the idea that is at the core of our very mission. Our opiate use disorder support program is designed around harm reduction and overdose prevention, and it is working. Our Austin Travis County EMS community health paramedics follow up on every overdose call in our system. They offer Narcan kits, overdose prevention education, and access to treatment and recovery options, including follow-up care with our nationally recognized Bridge program to assist individuals in getting into permanent treatment. These lifelines to those that need these resources are extremely valuable. Every life is important. Our community health paramedics meet these individuals where they are, wherever that might be, in their home, in encampments, or elsewhere. But they're not just responding to crises. They're building ongoing relationships, building the trust so that these individuals feel safe and able to pursue the needs that they have in order to overcome addiction. As we saw last summer, during that single surge of overdoses, the infrastructure that we are putting into place is critical. Our ability to flex in and respond to those needs at times of crises is invaluable and is with all of these partners that we have here to be able to set that up that made that effective. When we get harm reduction strategies into the hands of the public with training and access, we save lives. We are now distributing Narcan kits from all of our ambulances, seeing a 5-fold increase in the number of Narcan kits that have been distributed. And our Breathe Now classes in partnership with the Austin Public Health have saved countless lives and trained numerous individuals. We're proud of this progress, but we're not done. This crisis is evolving, and we need to keep pushing forward and with evidence-based, compassionate approaches. Again, I want to thank the court for all of their support. Just last year, with their continued investment into Austin Travis County EMS, with additional funding specifically for community health paramedics to help us address the needs of our community beyond just responding in ambulances. As our industry evolves, this is how we continue to save lives. Again, thank you, Judge Brown and the court, and at this time, I will turn it over to Maggie Luna from the Texas Harm Reduction Alliance.
Thank you, Chief, and thank you, everybody, for being here today. My name is Maggie Luna. I am the Executive Director at Texas Harm Reduction Alliance, and today we are here with some encouraging news. Drug-related deaths, including those caused by fentanyl, are down in Travis County. And while that is something to celebrate, it did not happen by accident. This progress is the result of intentional, coordinated work from every corner of our community. At Texas Harm Reduction Alliance, we work together shoulder to shoulder with people who are most impacted by the crisis. Our small but mighty team, all of us who have lived experience, have been on the ground every day. We have reversed overdoses at bus stops, on sidewalks, in encampments. We've distributed Narcan. We've hosted trainings. We help hundreds access housing, mental health care, substance use treatment, and medical care. This is what happens when community and government work together, not in silos, but in solidarity. Support from Travis County, Austin Public Health, EMS, and City Council and Judge Brown has helped us reach thousands, but our work is far from over. These numbers do represent progress, but they also represent people. And the reality is, without sustained and increased investment, this progress is at risk. We're facing a federal funding crisis, and the cost of living continues to rise. Yet our small but scrappy team serves 60 to 70 people a day at our drop-in center, a space that provides not only supplies but dignity, trust, and life-saving care. We have proven what's possible when you invest in people. Last year, we had over 300 documented overdose reversals, but we cannot let up now. We are asking the city to stay committed, the county to stay committed, and so that every person in our community has not just the chance to survive, but the opportunity to thrive. And I also want to just add a little anecdote. We had somebody come in front of Texas Harm Reduction Alliance on 1803 East Cesar Chavez, and they threw their car into park and they screamed Narcan. And we had a team run out to the street and reverse this man's overdose. It took 3 doses and 3 people to pull this person out of the car. But EMS showed up right after and saved this person's life. And a week later, he showed back up and thanked everybody who was on site that day. And so the community knows these resources are available and they are saving lives. So thank you.
Thanks, Maggie. And I just want to remind her, we talked about this last year, but y'all had that town hall that you dragged me and Commissioner Gomez and I think Commissioner Howard and some others here to it. And without that, I don't think we'd be at the same place today of making such progress. So thank you, Maggie, and the Texas Harm Reduction Alliance Network Alliance. Thank you. All right, so I think that's it. We also have Laura Pivoto from Health and Human Services here who works tirelessly on this effort. But if y'all have any questions for anybody up here, happy to answer those now.
Yeah, sure. Thank you, guys. Could you comment on, I know this report only includes overdose deaths, but could you comment on overdoses as a whole? And if you think those are going down as well, or the prevalence of Narcan is just saving lives and not a decline in usage overall?
I'd say it's a combination of both. As we looked coming into 2024, we saw a slight decline in the number of overdoses that we responded to. However, coming into 2025, we have seen a much more dramatic decrease. And so I think the overall strategies are working and kind of in a phased-in approach as we would expect.
Appreciate it. Obviously, federal funding has been a big part of the fight against opioids so far. Can you talk about, just given all the changes in D.C. and federal funding, where things stand as far as the grants that have been awarded? Are any of them at risk of going away? And are you in danger of losing any federal funding going forward?
Yeah, so first I want to say that Congressman Doggett has been a huge help in the past in getting federal funding for Austin Public Health and for our efforts here. And that's been tremendous. And I don't know, have y'all seen anything on grants that you want to?
No, as the county judge has said, Congressman Doggett has been instrumental in continuing to bring the funding here to our county. And as of yet, we have not heard of any negative impact on that funding at this point.
Yeah, go ahead.
One more for me. And there's going forward, anything you want to see from lawmakers at the state or federal level? I know testing strips, that's one of the bills that's before the legislature, I think even this week, or anything else that you want to see?
Yeah, so we'd love to see fentanyl test strips legalized at the state and the federal level. I think, once again, the state legislature has an opportunity to do this. I believe Governor Abbott has said he's in favor of it, so we're just hopeful that it can pass the Senate and the House. But Maggie, do you have anything else at the ledge you're looking at?
I know that we're talking about authorizing SSPs, syringe programs, which is probably the 10th year in a row that this has been introduced. But they are evidence-based, and people are more likely, 5 times more likely to enter into treatment if they're in contact with an SSP. And also the fentanyl test strips are extremely important. They are illegal, but they do spot fentanyl before someone puts it in their body. But we are also evolving into new drugs, and so drug checking is extremely important and needs to happen to save more lives.
Thanks. And I forgot to, are there any other questions? I forgot to say the part in Spanish, but go ahead, Katie.
Oh, I'm sorry. Do you mind expanding a little bit more on what an SSP is?
Yes, an SSP is a service, a syringe service program, and they are not legal in Texas, but they help reduce the spread of HCV, Hep C, HIV, and it's very important when people are given this resource to access, they are more likely to enter into treatment. I'm also somebody in recovery. I spent 20 years out there. I never had access to safe use supplies, and I lost a lot of friends. I have friends that are living with diseases today, and they are living in the public. And so this is a public health crisis, and syringe service programs are important for the public health and public safety.
So if anybody wants to hear me say something in Spanish, I'm going to do that now. Por primera vez en años estamos viendo una disminución significativa en las muertes relacionadas con las drogas en nuestra comunidad. El informe anual del médico forense de 2024 mostrará que las muertes inducidas por drogas disminuyeron en 25%. Accidentales en el último año, de 486 muertes en 2023 a 300. I cannot do this today. El informe anual del médico forense de 2024 mostrará que las muertes accidentales inducidas por drogas disminuyeron en 22% en el último año, de 486 muertes en 2023 a 380 en 2024. Hoy en día, las muertes relacionadas con el fentanilo, uno de los factores más letales de la crisis de sobredosis, han disminuido en un 36%. Gracias. All right, thank you all very much. Thanks for being here today. That's everything. Okay, great.